So for someone who's coming from out of town, someone from out of town or overseas, typically I would do a Skype consult with them. We talk about what their goals are from a breast augment point of view, do a general medical history, find out if they have any major medical issues, find out what medications are on, and then we'd have a general discussion about things that are important for their recovery. So make sure that they're not smoking. They have to understand that post-op recovery period, make sure that they're moving afterwards, not sitting around. The important thing to understand with being someone who needs to get on a plane or wants to get on a plane within 7 days afterwards is the risk of DVT. Risk of DVTs can happen in any operation, and the important thing there is to make sure that the patients keep moving and not to sit. Any operation that happens, big or small, creates inflammation in the body, and that inflammation can contribute to things like DVTs or pulmonary emboli or PEs. Those are blood clots in the lungs. And so the important thing there is to maintain movement without being that high impact, back to the gym kind of activity. So typically we go through that as a Skype consult or a FaceTime or a phone call consult. Go through all the general medical, think about what they wanted to get out of a breast augmentation. The important thing there is also to be able to see photos. So if patients are comfortable to send photos, I'm happy to look at them and say if they qualify for just a simple breast augmentation or whether or not they need an augmentation mastopexy. And what that is both a breast augmentation as well as a lift at the same time. Sometimes photos don't tell the whole story, and we really need to see face to face with those sort of things. I would typically get patients to do a little bit of research beforehand, start talking about things like round implants versus teardrop implants, and maybe come in during that first consult with some ideas about what they were going for. And even if during that Skype consult, if they had those available, that's even better, because that again gets us on the same playing field of where we are and where we're headed. So the important thing is to make sure that there's no issues within that first week. So most patients would need to be around for at least 7 days. So if I saw them, say on a Wednesday, we operated on a Friday, I should see them the following Friday before they head back. Any issues, any acute or major problems that would happen within those first 7 days. It would be very rare to have something happen after that stage. I think the important thing about those 7 days is also that it's forced rest. So you're not getting out and doing something that really will put you at risk of having a problem. And it's a time to relax. It's a time to just chill out while you're recovering and enjoy Brisbane.